The second important factor, which is commonly asked in the exam, is about the vascularity. And you should know that the proximal femur or femoral head vascularity changes during the childhood. So it's different when you are born. It's different from 3 to 4 year age to about 10, 12 year of age. And then it is different once the physis is fused. So let's go a little bit detail about this. So when we are born, there is no physis. All this is cartilaginous. So the blood vessels are actually just crossing without any resistance of the physis here. So initially, first few months or first few years, the blood supply is not too bad, but then this growth plate or the epiphyseal plate is become resistant to pass these blood vessels.